One local primary care provider is stepping up after a Plymouth clinic closed its doors. Now to your side, Gray Barr has that story.
It's becoming an all too common story here in eastern North Carolina. A healthcare provider closes its doors, leaving both patients and clinic staff with uncertainty. On March 12th, O'Neill's family practice shut down. Days later, Agape Health Services offers jobs to all of the clinic's employees.
Renee Price worked at O'Neill's family practice in Plymouth. Previously, the facility was Roanoke Clinics and was a part of the Martin General Hospital network, which closed last August. Renee says the clinic became O'Neill's family practice in October, but closed less than 6 months after opening.
March the 11th, on that Monday, Mr. O'Neill came to us and told us that he was no longer going to be able to keep the clinic open, and it would be closing as of March the 12th.
The reason? She says employees were told the overhead costs exceeded insurance reimbursements at that time. The reimbursements helped to pay to keep the facility open, salaries, utilities.
I was mainly concerned about patients and how they were going to feel. There's not a lot of options there as far as access to health care.
Dr. Michael McDuffie of Agape Health Services says he met with the employees of that clinic and offered them jobs on the spot.
They were happy to know that they will still have a job. They were happy to know that they wouldn't have to leave the community that they have served in.
And now he says the providers are where they should be, in Plymouth, with their patients.
It's important to try to keep those providers in those communities. Particularly, Renee has been serving that community for about 15 years. And it makes sense for her to be able to stay in that community.
McDuffie says there's hope for health care in eastern North Carolina in the form of community health centers.
We call ourselves safety net providers that are stepping up, not only in just eastern North Carolina, but throughout North Carolina.
But I don't feel defeated. I feel like I'm still afloat and still able to have my license and still be able to practice medicine and fill in the gaps in between if I have to.
Agape says they take all major health insurances, Medicaid and Medicare, and have a sliding pay scale for uninsured patients. We'll have more information on that on our website at WNCT.com. In Washington, Gray Barr, 9 on your side.